Casey Eichelberger. I'm a maternal fetal medicine physician here in the upstate, and I'm also chair of the Department of Obstetrics and Gynecology. As an MFM physician, one of the things that we do is help pregnant women and lactating women make decisions about treatments, vaccines, medications, etc. that they may be considering. And my hope today is to share a few things that we know about the COVID vaccine with you in the hopes of equipping every woman on our healthcare team with the information to make a decision that feels right for her and for her family. So before I went to medical school, I actually spent a year teaching elementary school, so I love whiteboards, and I'm going to use this today to walk through a few things that will be helpful just as a primer on vaccination. So the first thing we think through are what are the types of vaccines that exist right now? What are kind of the common buckets that we think of? Live attenuated vaccines are the ones that are the easiest to think through. It's where you give a full germ, a load of germ in some medium to people to inoculate them, although that germ, frequently a virus, has been weakened or attenuated. Examples of this are the measles, mumps, rubella vaccines, the smallpox vaccines, varicella, and yellow fever. These are vaccines that we never use in pregnancy. Smallpox vaccines have been associated with adverse outcomes in pregnancy, the others less so, but we do not use these in pregnancy. Inactivated vaccines, on the other hand, are taking the whole virus or germ and actually killing it. So it is not just weakened, it's actually inactivated. The flu shot is a classic example of this, and obviously we do use these in pregnancy. Rabies shots are another example in that category. Category 3 is something really interesting, and we're going to get to this because it's close to what our COVID vaccines are. This is called a subunit recombinant or polysaccharide vaccine. Common examples here are the hepatitis B vaccine, the shingles vaccine, and pneumococcal vaccines. These can be used in pregnancy. And the idea behind these is that you take a small protein or a small piece of sugar that is associated with a germ or a virus, and you give that to the body to make an immune response against. So it's not using the whole attenuated or weakened virus, it's not using a dead virus, it's actually just using something that's like a fingerprint of the virus and showing that to the body. The fourth category of common vaccines are the toxoid vaccines like tetanus and diphtheria. We do use Tdap vaccines in pregnancy. Pertussis tends to be in this category, tetanus in the toxoid. So these can be safe. Toxoids are things that actually are not a part of the germ or virus, it's something that produces, and so you make a response against that. So now let's get to the mRNA vaccines that Pfizer and Moderna have came up with that are against COVID or the SARS-CoV-2 virus. So one of the things that we know about that virus that actually is fantastic about coronavirus, if anything is good about it, it's this. It's kind of a showy virus, and what I mean by that is that it has all of these fancy spike proteins that sit on its surface. It makes it hard for an immune system not to recognize it. So it has these very obvious markers when it enters our body that say that this is something different. So the way mRNA technology works is that it wants to show this type of protein, this S protein, to our body so that if and when we're infected with the actual virus, we have antibodies that can target this, mark it as abnormal, and destroy it. So one way to do that would be to actually inject something in a vaccine that gives you that S protein. That would be a lot like this category of vaccination. However, mRNA technology is a little bit more clever than that. It looks at this protein and says, what is the mRNA that actually encodes that? So you have a tiny strand of mRNA, and then they wrap it in a layer of lipid, actually 2 layers of lipid. And that is vaccine. That's what it looks like. So that vaccine is injected into our bodies. We have a cell in our body, any cell really. This lipid layer fuses with the lipid layer of our cell, and that mRNA gets injected. We have a nucleus up here, and this is very important, that contains our DNA. That mRNA does not get close to our DNA. It does not alter our genetic code, okay? It's also just a tiny piece of mRNA. It is not the whole virus. It is not a whole dead virus. It has nothing to do with that. It's just a tiny little bit of mRNA. So it's less of a hammer approach and much more of a scalpel approach. It's a more finessed approach. That mRNA gets in our cell. We have these little things called ribosomes. Those ribosomes translate that mRNA, And we essentially make these little spike proteins that get put on our cells via two receptors called MHC. This is fancier than most of you want to know, but that MHC then presents this little spike protein, and our body's B cells and T cells go to work making antibodies just to that, and those are stored. These B cells become plasma cells, which are fantastic. They make a ton of them. They have long memory. We end up with all of this antibody floating around, and it's just waiting for the time when we may be infected with actual virus. If so, our body will see that. It will say, that's very familiar. We've seen it before. We saw it not because we had it before, but because somebody gave us that mRNA, and we will use these antibodies to get the virus. In studies, what we found with the Pfizer and Moderna vaccine studies, 44,000 in one, 30,000 in another, is that there is about 95% efficacy rate. What that means is that these vaccines, these mRNA vaccines in clinical studies, reduce the rate of infection by about 95%. They report to be 100% effective against severe infection. That's truly tremendous.